Hello everyone, it's me. It's February 6th, 2014. Um, I'm here to update you about what happened yesterday at the orthodontist. I got some informative things told to me about my treatment. I got some molds done, I got some x-rays done. I got a couple answers given to me also. I was very persistent and told them, it's been 4 months and I really don't know what's going on still. Can someone just give me the consultation now? They're going to wait 2 weeks to give me a consultation after giving me molds and x-rays done, even though they had the x-rays there and my mouth there. So I just was like very assertive. I'm like, you know what, can you just give me a couple minutes of your time, explain some stuff so I can get my ducks in a row to get this moving along, because it's already been 4 months and I haven't really, the journey hasn't really begun yet. So yeah, so yesterday I got these x-rays taken, and they are treating me with my new bite. So this is my bite closed. I now have the classic open bite facial structure, because before I had an open bite but my jaw was too far back. But now I have that classic anchorfish grouchy face going on. So this is it again. Before it used to be here. It's me now. Kind of weird. So yeah, I was wearing, to anyone that doesn't know, I was wearing this splint to relax my jaws muscles, because everything was way too tense. My jaw was too far back. I stuck my thumb for way too long, pretty much. Long story short. So for the future, I'm never having my kids do anything like that over the age of 1. Sorry, but it's true. This is why I'm having problems and costing 30 grand. So I'm not going to buy a new car. I already have a nice car, so I figure I can't catch a break, This is the x-rays in my head. It's my little head. My airway is looking good because my jaw is forward now. There's a little bone down here that's attached to your lower jaw, and before it was really far back because that's where my jaw was, but now since my jaw moved forward, my airway has opened up, which is good because I'm an asthmatic, and that the more the better. It's great. So as you can tell with my bite, none of my teeth touch except for my last 2 molars. They might look like they do, but inside they don't. See? They only touch way up here. There's my smile. My bite now. Yeah, it's kind of weird. Before, this was my bite. Now it's here. I can do that. I can do a lot of cool tricks. It's really great. But anyways, so my jaw is a little small, my lower jaw. My chin is not very prominent. I don't really have like one of those, like, I don't have a bump. It's just flat. I don't really have a chin. It's just part of my lip, I feel. So, but they're going to do a surgery where they cut a pie shape out of my upper jaw, and they're going to move my upper jaw up and in this way so that my lower jaw can come in and just whoop, pop right in there. So this is also the front x-ray. Very pretty. Those aren't cavities, those are my teeth lining up and overlapping, don't worry. The middle part is where my teeth don't touch. That black, anything that's really black is where there's air. So my teeth don't touch like that. You can see. I had to try to line up my teeth with this little white stick that you put in to line up your jaw. I couldn't bite down on it. I told him I haven't opened my dumbass. Like, how am I supposed to do that? I didn't say that, but you know what I mean. So based on this, none of my teeth line up. My molars are way too ahead of this one right here, my upper one. This is way too far forward now because my jaw is forward. So it's weird to see your bones in an x-ray, especially your face, because, I don't know, it's just kind of cool that that's what's causing me problems. So anyway, they took a couple molds of my face. Felt like the girl from the Saw because, yeah, this time, I'm going to feel like her when I have surgery. They did all these angular gadget measurements and stuff, and it's kind of intimidating, but they're just trying to get accurate angles and calculations to make a mold of my upper and lower jaw to give me a better prognosis on my treatment. I'm going to get braces, metal braces, probably rubber bands, top, bottom, and they're going to do the braces to fit each jaw individually. They're not going to look better as my braces go. They're going to be straight, but they're not going to overlap because they're treating me for surgery. They're not trying to manipulate my teeth to cover it up, basically. They're going to let the surgery fix it. And with the surgery I'm getting, it's the upper jaw, and they're going to expand my palate and cut it in like 3 pieces and put it together to widen the front. That's why my teeth don't line up, because my upper jaw right there is too small for my lower jaw, and that's why they don't touch. Well, one of the reasons why they don't touch. And with the braces, I'm going to have a tongue thrust device so that it stops my tongue from hitting my teeth, so that it trains my tongue to stay where it should. So after surgery, I don't mess things up and like go right back to where I was. But hopefully, when I have a wider palate, my tongue, that's the reason why I have a tongue thrust also, is because there's no room for my tongue to go because my palate is kind of narrow. So it's all pushing in the front. Your tongue's supposed to rest on the roof of your mouth. Mine pushes on my teeth. So with every swallow, I think is like 7 pounds of pressure towards the back of your teeth, which is a lot of pressure. So yeah, trumpet actually helps keep my teeth a little straight this way, not so bucked, because if I was doing this since I was a kid, like when I was a kid, they were really bucked, and I started playing trumpet, and they got flatter. But it also caused a lot of other problems. So about lower jaw, they don't know if I'm going to have the lower jaw surgery yet. I probably will. There's a girl online, a different one that I found today, and I was like, holy crap, this girl has the same exact x-ray profile as me. The same exact thing. Like, my jaw is so weird compared to normal people, my lower one and my upper one. Because my lower one is on such a steep angle because my teeth don't touch all the way, and it's small, and my chin is really flat. This girl has the same freaking thing. I couldn't believe it. I was like, what? Okay, cool. And she already had it done, so I can see what it looks like and see what her surgery, how it went. And she ended up having the lower jaw cut and moved forward, and a genioplasty, which is when the chin is cut and moved forward, because my chin is flat, and I never realized it was flat. It's just my jaw is a little bit underdeveloped lengthwise, just because I stuck my thumb for so long. So we'll see. The braces, I don't know. I'm almost positive I'll have the lower jaw done too, and my TMJ. So I'm gonna have, probably, hypothetically speaking, I might have 5 different things done in one surgery. It's kind of freaking me out, because it's like, I need this to get fixed. I need the palate expanded. I need my upper jaw moved in and out. I might need my lower jaw moved forward, my chin moved forward. So I'm basically having reconstruction done on my face, like the entire thing. Like, my whole freaking face is going to be different. They're basically just cutting it all apart and putting it back together in different spots. The good thing about this is that I'll be able to bite down and have pressure hit all of my teeth. That's the reason why I'm having so many issues, is because my teeth are only touching in the back. Oop. And it's causing premature aging on my teeth. My molars in the back look like a 4-year-old woman's molars. They actually started splitting a couple years ago, and they had to put a filling over the top of it to make sure that they weren't splitting in 4s more, because all the pressure, chewing, clenching your teeth in an accident, talking, anything, it's like it all rests there. It doesn't go anywhere else. So that's a huge reason why I'm getting this surgery done, because I could potentially lose all of my teeth. So I don't want to do that, obviously. Also, is so I can bite and eat properly and swallow properly, because it also helps with like your digestion. If you can't chew and swallow properly, you're swallowing a lot of air. You're also not chewing your food as much, so it's more effort on your digestive system to do that. So hopefully with all this, it'll be good. I'm guessing it'll be good. It will be good. I can't wait. I honestly can't wait to get braces, because that means, oh, and braces aren't as expensive as I thought, which is awesome. So once I pay for the braces, that's done for a while, and then I'll be able to like save up more money, get my more ducks in a row, get everything situated, and then I know I'll get slammed with a bill for the surgery, but like that's the only thing left I have to do is the surgery. So honestly, I'm lucky I don't have a lot of student loans, so it could be worse, but it just sucks, I guess, because I just graduated college last year and I already have all this going on. So, um, but yeah, so in 3 weeks I'm going to a surgeon to talk about my treatment so that we can write a letter and a report to the insurance company so they can accept my reason to get this done and help me cover some of the cost of this because it'll be a lot. So, and after that, like once the insurance company hopefully okays it, then I can get my braces. My orthodontist didn't want me to get braces right now because she didn't know if the insurance would cover it and she didn't want me to be in the hole. But I think either way though, I would have to, I don't know, I would figure something out. I would get a new insurance, and you can't get any surgery like that done within 6 months of getting a new insurance company. So I still have to wait 6 months anyways to find, it'll be fine. So if not, you write an appeal, and if you try hard enough and act quickly enough, and you're assertive and don't base it around your looks, and you obviously by x-rays and diagnosis from the surgeon you have issues, those are the reasons why you get this done. So I really hope that my surgeon is on my side with this and helps me out because it's been a long, miserable ride. So I don't really know if I have anything else to tell you guys. This month will go by quickly, so that appointment's in 3 weeks. After that, I'll probably get braces in March, honestly. It's be my last month without braces for like 2 years, and I'll have a different face. It's gonna be weird. I'm gonna have cheekbones, like actual cheeks right here too. It's gonna be so weird because they push it in, so that means that like all this develops, and then my face will be shorter because they're cutting a chunk here and moving it up. It's just gonna be so crazy. Weird. But anyway, so that's all I have. Thanks for watching.